Hello, my name is Dr. Carolyn Salter, and I'm a urologist specializing in male sexual and reproductive medicine. Today, we're going to talk about delayed orgasm in men. So, delayed orgasm basically refers to a man who has a hard time achieving an orgasm. There's not a specific time definition for this, but I typically use the metric that if the man is stopping sexual stimulation because he's physically tired, because him or his partner are sore, or if he's bored or just simply doesn't have the time to dedicate to this task, that would be pathologic and something that I would consider to be delayed orgasm. Delayed orgasm can be situational. So, for example, some men can achieve an orgasm on their own with masturbation, but they are unable to achieve orgasm in a timely manner with a partner. However, some men have difficulty achieving orgasm regardless of the sexual situation. Delayed orgasm can be primary, meaning that since the first sexual encounter, this has been an issue, or it can be secondary, meaning that the man had a prior period of normal orgasmic function, but now he suffers from delayed orgasm. There's a few different causes of delayed orgasm. One is medications. So many psychiatric medications, particularly antidepressants, are quite bad for your orgasm. Now, that being said, it's really important if you're on these medications to talk to your prescribing provider about them because these are often necessary medications and it's not safe to come off of them immediately. So even if your provider says that you can stop these medications, you have to taper them or gradually reduce the dose in a safe manner. You never want to come off of these medications cold turkey. Sometimes you're not able to come off the medication, but maybe they can lower the dose. Maybe they can switch you to a different antidepressant that's better for orgasmic function, or maybe they can add another antidepressant. Again, that's better for orgasmic function. So if you fall into this category, please talk to your provider. Men can also have a hard time achieving orgasm if they have really low testosterone. This is not typically seen in men with kind of more standard run-of-the-mill testosterone deficiency, but for example, when we purposely castrate men for prostate cancer treatment, so if men are on androgen deprivation therapy, it's very difficult for these men to achieve orgasm. Another common cause of orgasmic delay is from a change in sensation of the penis. So as you can imagine, if the penis is not as sensitive anymore, it would be harder to achieve an orgasm. And so this can be if men have had chemotherapy for cancer. Some chemotherapy is very damaging to the nerves. There's something called neuropathy, and this can make it difficult for these men to achieve orgasm. Or if someone has poorly controlled diabetes or certain nutritional deficiencies, again, they can get damage to the nerves, and that can lead to a reduced sensation in their penis. Regardless of the cause of delayed orgasm, a really quick and easy way to try to manage this is with vibratory therapy. And so this is usually what I recommend to my patients. And what we do is we essentially try to overcome the difficulty in achieving orgasm by increasing the stimulation to the penis. So what I recommend is that patients buy a vibrator, really any kind will do. And I recommend that men put it on their frenulum, which is the most sensitive part of their penis. And this refers to the skin bridge on the underside of the penis that connects the head to the shaft. Men who have delayed orgasm can often achieve normal orgasmic function by using vibratory therapy, and it's safe for essentially all patients. So that's something easy that you can do on your own. There are some medications that can help with delayed orgasm. I already mentioned certain antidepressants, for example, Wellbutrin, are thought to help with orgasm. And there's even other medications that are specifically thought to help with orgasms, but none of these are FDA approved. So it's really important to talk to your doctor to see if potentially you'd be a candidate from these medications. But again, my first line is penile vibratory stimulation, which can be really effective in many men. Thank you.